1. May play a role in treating enlarged prostate or benign prostatic hyperplasia. In a randomized, double-blind, placebo-controlled trial published in 2009, 47 benign prostatic hyperplasia patients were assigned to 4 groups. Group A took sweet potato starch, 320 milligrams per day. Group B took pumpkin seed oil, 320 milligrams per day. Group C took saw palmetto oil, 320 milligrams per day. And Group D took a combination of pumpkin seed oil and saw palmetto oil, 320 milligrams per day each. Even though no difference was observed in prostate volume in all treatment groups, in groups B, C, and D, the International Prostate Symptom Scores decreased by 3 months. Group D showed improved quality of life scores after 6 months, while groups B and C saw improvements after 3 months compared to the baseline. Serum prostate-specific antigen reduced only in Group D after 3 months. Maximal urinary flow rates gradually improved in groups B and C, reaching statistical significance after 6 months in Group B and after 12 months in Group C. The findings suggest that using pumpkin seed oil and saw palmetto oil is safe and may be effective as complementary treatments for benign prostatic hyperplasia. In another trial published in 2015, 1,431 men with lower urinary tract symptoms suggestive of benign prostatic hyperplasia were randomly assigned to receive either 5 grams of pumpkin seed, 500 milligrams of pumpkin seed extract, or a placebo. The primary response criterion was a decrease in the International Prostate Symptom Score. After 12 months, there was no significant difference in response rates between pumpkin seed extract and placebo. However, there was a descriptive significance for those who took actual pumpkin seed. Also, in a single-arm, monocenter pilot study published in the Journal of Medicinal Food published in 2019, researchers investigated the effects of a proprietary oil-free hydroethanolic pumpkin seed extract on the symptoms of benign prostatic hyperplasia. 60 participants took the pumpkin seed extract once a day before bedtime. The study found a significant 30.1% reduction in benign prostatic hyperplasia symptoms, making a positive impact on the quality of life of the participants. Issues like waking up at night to urinate also decreased. The extract was well tolerated, suggesting it might be a helpful option for those with benign prostatic hyperplasia symptoms. Moreover, in a randomized controlled trial published in 2021, researchers compared the effects of tamsulosin and pumpkin seed oil on benign prostatic hyperplasia symptoms. Tamsulosin is a medication commonly used to treat symptoms associated with an enlarged prostate. It belongs to a class of drugs called alpha blockers. Of the 73 patients included in this study, 34 took 0.4 milligrams of tamsulosin, while 39 took pumpkin seed oil. There was no significant difference between the 2 groups at any point in the study. However, both groups showed a significant improvement in symptoms and quality of life. While the tamsulosin group had a greater reduction in symptoms than the pumpkin seed oil group at 1 month and 3 months, the change in symptoms from 1 to 3 months was similar for both groups. No side effects were reported in the pumpkin seed oil group, but the tamsulosin group experienced side effects like dizziness, headache, retrograde ejaculation, and skin redness with itching. 2. May play a role in treating hair loss or androgenetic alopecia. In a randomized, double-blind, placebo-controlled trial published in 2014, researchers investigated the efficacy and tolerability of pumpkin seed oil for the treatment of hair growth in male patients with mild to moderate androgenetic alopecia, AGA. 76 male patients with AGA received 400 milligrams of pumpkin seed oil per day or a placebo for 24 weeks. Results showed that the participants who took pumpkin seed oil rated their hair improvement and satisfaction higher than those who took a placebo. The pumpkin seed oil group ended up with more hair than they started with, whereas the placebo group had less increase. On average, the pumpkin seed oil-treated men had a 40% increase in hair count, while the placebo group had a 10% increase. Both groups did not report any significant side effects. And in a randomized comparative trial published in the Journal of Cosmetic Dermatology in 2021, researchers looked at the effectiveness of pumpkin seed oil in treating female hair loss and compared it with minoxidil 5% foam. They had 60 participants with female pattern hair loss, and each group had 30 people. After 3 months, both groups showed a significant improvement. The pumpkin seed oil group had a decrease in diverse hair types and fine hairs, while there was an increase in growing hairs. The minoxidil group also had positive changes in these aspects. The study suggests that pumpkin seed oil has potential in treating female hair loss.
By the way, before I continue, if you're new here, I'm Jera from the Philippines.
Welcome to my channel where I share my knowledge and discoveries about everything related to natural health remedies and personal development gained from reading scientific journals and books written by doctors and experts. If you also have a gluttonous appetite for new knowledge, please consider subscribing. Also, you may want to check out my ebook, 40 Wrinkle Fighters Other Than Retinol, backed by scientific studies. Just click the link in the description box below for more details.
Moving on, 3. May have potential benefits for heart health. Rezan Khan, a consultant nutritionist from Shifa International Hospital, along with his co-researchers, investigated the effects of pumpkin seed oil on heart health. Their study was published in 2020. They gave 127 participants, aged 39 to 63, 1 gram of pumpkin seed oil, or just dietary and lifestyle advice for a certain period. Those participants who took pumpkin seed oil showed a significant decrease in bad cholesterol and blood pressure and an increase in good cholesterol. These are positive outcomes for cardiovascular health, suggesting that pumpkin seed oil may have beneficial effects on cholesterol and blood pressure. The study included participants with multiple medical conditions, which may introduce confounding variables. While the findings are promising, more comprehensive studies with consistent methodologies and larger participant groups would strengthen the evidence. 4. May help treat urinary disorders such as overactive bladder. According to a 2014 study involving 45 subjects with overactive bladder, the daily intake of 10 grams of pumpkin seed oil from a specific type of pumpkin called Cucurbita maxima significantly improved urinary symptoms in the subjects after 12 weeks. Future studies could explore different dosage levels to determine the optimal amount for efficacy while minimizing potential side effects. 5. May have some benefits for postmenopausal women. In a randomized, double-blind, placebo-controlled trial published in 2011, 35 postmenopausal women were randomly assigned to either 2 grams of pumpkin seed oil per day or 2 grams of wheat germ oil per day. After 12 weeks, the pumpkin seed oil group experienced a significant increase in good cholesterol and a decrease in diastolic blood pressure, and improvement in menopausal symptom scores, with reductions in hot flushes, headaches, and joint pains. The wheat germ oil group reported increased feelings of depression and being unloved. The study authors concluded that the pilot study showed pumpkin seed oil had some benefits for postmenopausal women and provided strong evidence to support further studies. 6. Can be used as a potential agent in lowering the risk of bladder stone disease. In a clinical trial published in the American Journal of Clinical Nutrition in 1987, the researchers studied the impact of pumpkin seed intake on urine composition in 20 boys aged 2 to 7 from a region in Thailand with high rates of oxalate-related kidney stones. The trial included 4 phases: control, before treatment, oxalate supplementation, pumpkin seed or orthophosphate supplementation, and post-treatment. Morning and 24-hour urine samples were analyzed for various components. Pumpkin seeds showed positive effects, reducing calcium oxalate crystals and calcium levels while increasing phosphorus, pyrophosphate, glycosaminoglycans, and potassium. The results demonstrated that the longer the supplementation period of pumpkin seeds, the better were the results. This suggests pumpkin seeds could help lower the risk of bladder stone disease. While further studies are clearly needed, this is a promising finding. Processed and prepackaged pumpkin seed products may be high in sodium and contain additives. Opt for low sodium or raw varieties. Also, excessive intake may cause digestive symptoms or a rash, especially for people with allergies or sensitivities.
If you've learned something you didn't know before watching this presentation and you appreciate the time I invested in researching, writing, and creating this presentation, please give this video a like. If you're interested in looking and feeling your best and exploring natural solutions, please consider subscribing. Thanks for watching.